for Nimbasava. So what in clinical practice, what you have to do is that Nimbasava has to be mixed with Saindava. So you just start with 5 drops. 5 drops. If the patient is comfortable, you can go up to 5 drops will be around 0.5 ml, 0.25 ml. So we do it up to 3 to 4 ml. Okay. But don't go for 3 ml directly. When you start out your practice, always start slow. Give 0.5 ml. If the patient is comfortable, you can go for 10 ml. I mean, not 0.5 ml. What I meant was 5 drops. Sorry, 5 drops. So start with 5 drops. Then increase it to 10 drops, 15, 20, up to 40 drops you can easily put. But give it slowly. If the patient is having improvement, and if the patient says that after the Nasya he is having severe headache, that means that the thing has changed. In Kabaja Pradishaya, if you give Nimbasava, the patient will be having relief. If the patient is not having Kaba and you are giving Nimbasava, that will aggravate the Vada. So the patient will come with severe headache. So that is how you identify whether that Kaba has completely gone or not. Got it? So then you can practice Nimbasava. So Nimbasava is also easily available. You get it as such, and you can add Saindava and give for Nasya. Then Tulasi Swarasa. Tulasi, you know, it's very easily available in your place, and you just have to take Tulasi and take Swarasa. Again, start with Tulasi Swarasa is more Tikshna than Nimbasava according to me. So you can start off with 2 or 3 drops initially, and if the patient is comfortable, you can increase that Nasya. So, and I don't practice Anutaila Nasya at all, because Anutaila is having it is a Taila base. Of course, when you put Anutaila in sinusitis patient, of course you will have some kind of coming out. That is because of the irritation that is caused. It is not because of the medicine. In a Kabaja Pradishaya patient, you put anything inside the nose, any Tikshna thing in the nose, the secretions will come out because of irritation. That is not curing the disease. So don't put Anutaila in the initial stages. Go for something Tikshna. And so that is it regarding the treatment. So now I think you have got an idea about how to treat a Pradishaya patient, isn't it? So Navavastha, Amavastha, Pakvavastha, Dushta Pradishaya. Navavastha, you don't give any treatment. Then Amavastha, I told you have to modify the diet and the activities. Then and in Pakvavastha, you have to identify which dosha it is, and if possible, go for Nasya. If you give Nasya in Pakvavastha, you will get definite result in 2-3 days. And if the patient is not willing for Nasya, then you can go for Vyadhi Pratirika Chikitsa. That I have given you the chart. You can just try out some of the medicines. You can add it to it. I just gave you some of the things which I use. Okay, there is people use different medicines. So you can add to that chart. It is not the final thing. I just tell you that this is how I treat the things. Then next is sinusitis. So what is sinusitis? It is the inflammation. See, these are the sinuses, frontal sinus, ethmoid, maxillary and all. So when this sinus get inflamed and when you have pus inside it, then you call it as sinusitis. So usually rhinitis and sinusitis come together. So you call the condition as rhinosinusitis. So what happens is there is cilia. The ostia means the openings inside the sinus. So the ostia has got cilia. So that is helping the pus that is collected to come out. But in sinusitis patient, what happens is that ciliary action is not there. So the pus will be collected inside the ostia itself. So blockage of the direction, blockage of the mucus from sinus to the nasal cavity. So usually what happens is that the pus that comes in nasal cavity, sinus, is thrown into nasal cavity by the ostia. When the cilia is not functioning, that won't be happening. So you have pus that accumulates in the ostia. So infection of the retained symptoms leads to manifestation of symptoms. So here excessive nidana sevana, mostly sinusitis is related to kabaja nidanas. So that leads to srodoroda, kabasanjaya, sammurchana, manifestation of lakshanas. So in samprapti, we have to think about tikta kadurasa, ruksha ushna, then sukshma and lagu to pierce the sinuses. So virya will be ushna, so karma will be srodoshodana, kabavitta shamana and kafa nissaraga. So these are some of the options which you can give for sinusitis. Again, I told you, sinusitis also you can correlate it to Kapha Pradishaya. So in Amavastha, you know what is to be given. Pakvavastha, you know what is to be given. So if you don't have a choice of the Nasya only, you can go for this treatment. So you can give Varanadi, Kadutraya, etc. Then Shaddaranam, Arishta Asabas and all those things. Arishta Nasya. And in practice, you can give Leba. You know Rasnadi Churna? Yes. So Rasnadi Churna with lime. If you can Jambira, if you can mix that and apply, you can just heat the Rasnadi plus Jambira Swarasa and apply Leba. So when I tell you, this Lebas and all those things are effective only in long run. I would always say that go for Nasya. Only if you don't have option, go for this Lebas and all those things. Okay, but these can be done. That is Leba. Then Sweda also helps to some extent to relieve the heaviness of head. And here, one thing you have to notice that when you attempt, like I told you, the sinusitis case, what happens is the pus is getting accumulated. But in some patients, what happens is that the ostia gets blocked. You understood? So how does our Nasya act? That is Nasya, Tikshna. I told you Kapha Nisarga and all are the properties of the things which we select. So these drugs will irritate the pus and then bring it out. Okay, but what happens if the ostia is closed? The irritation will happen because the absorption is happening. And the patient will be having more severe complaint. So if he has come, if the whatever complaints he has come to you with, that is heaviness of head and all, will be increased at least up to 4 to 5 times. So what should you do? If you are going for an Arishta Nasya or Asava Nasya, it's always safe to advise and scan to find whether the ostia is open or not. A CT scan is sufficient. So in the CT scan, you will be writing PNS CT with OMC. OMC means osteomeatal complex, to comment on OMC. So when the radiologist will give you a scan report with the condition of OMC. So if the OMC is blocked, then don't go for Nasya. Okay, because the patient's condition will worsen. Did you understand? If the ostia is blocked, our medicines will cause more damage. So don't do Nasya if the OMC is closed. In that case, if the patient is not willing to go for allopathic treatment, you can go for Vyadhi Pratinega. Like all the Kashayas, Leba, Sweda, etc. can be done. Don't do Nasya. Then next is allergic rhinitis. That is IgE mediated immunologic response of the nasal mucosa to airborne allergen. What happens is that you have an airborne allergen. So when it enters the body, antibody will be produced. Okay, so the body will be having antibody. So in the next exposure, when another exposure happens, the antigens, the new antigens will react with this antibody and will cause this irritation. And the patient will be having rhinorrhea, nasal blockage, itchiness, sneeziness, etc. So inhaled allergens will produce specific IgE antibody in the genetically predisposed individuals. So this antibody becomes fixed to the blood basophils or tissue mast cells by its Fc end. On subsequent exposure, antigen combines with IgE antibody at its Fab end. This reaction produces degranulation of the mast cell with the release of severe chemical mediators, some of which already exist in the preformed stage, while others are synthesized afresh. So here there is reduced Rogibala, Kabha Visheshan initially, Visheshan of other doshas, Thana Samsaraya, manifestation of symptoms. Okay, so in allergic rhinitis, the general treatment protocol that we follow is, that is 3 phases. One is avoidance of allergens like Nidana Parivarjanam, which I have already told you. Then pharmacological management or Vyadhi Vibridham, and immunotherapy or Rasayana. So again, I've prepared a chart of things that we generally use to treat this along with the Rasayanas. You can just go through it. But here again, I want to highlight what, even though allergic rhinitis, we can correlate it to Kshavadu also. How is allergic rhinitis, I mean Vadika Pradishaya and Kshavadu different? Kshavadu, the main symptom will be Kshavadu or sneezing. In allergic rhinitis, I mean in Vadika Pradishaya, the patient will be having Nasa Ubarodha. That Nasa Ubarodha will be absent in a patient with Kshavadu. But Kshavadu is both, according to Susruta and Vagbada, it is a Sadhya Roga. But when we see patients, you see that patients taking cetirizine for years along. That is, if they don't take cetirizine, they will be having sneezing. I've treated so many patients like that. That is, they are dependent on some kind of anti-allergen medicines. So here, when we look into the text, you see that all the Acharyas have adopted a common treatment line, Pradhamana Nasya and Shundyadi Taila Nasya. So have you heard about Pradhamana Nasya? What is Pradhamana Nasya? Churna Nasya. Where have you heard about Churna Nasya other than Nasaroga? Sannyasa. So Sannyasa, Apadanaga, that kind of disease you give, Apadandraga and all, you give Pradhamana Nasya. So there, what happens is that Kava Avarana, severe Avarana of Kava is there. So in such severe Avarana only, the Pradhamana Nasya is advised. So here again, in allergic rhinitis, I have seen that the Avarana is very severe. So Pradhamana Nasya has got a wonderful result. Though the patients who come to you with taking cetirizine for years, they improve with just 1 or 2 weeks of treatment. And for the last, I came across this medicine 2 years back. So since last 2 years, I have been practicing it very commonly in my practice. That is, at least 2 to 3 patients we do weekly for allergic rhinitis. And in my experience, only one patient has not responded. I don't know what happened to her, because I tried several medicines. It didn't respond. The others all have got improvement from 50 to 100%. But patients are happy even with that 50% result, because their daily activities are not affected much. Previously, when they have severe sneezing, they are unable to attend the office work, they are unable to study and all those things. So that kind of things, they have mild sneezing, that is what remains in some patients. In some patients, it is completely disappears. So it is one of the best medicines that I have found in allergy. If you give medicines, if you give the internal medicines, you give them 3 months, 4 months, 5 months, you get very little result. And once you withdraw the medicine, it's back. But when you do this, they can get relief up to 1 year. And after 1 year, they themselves come to us, telling they want to do a Nasya. The symptoms are resurfacing. So you have to understand that allergic rhinitis is not something which you can cure completely. So you give them some kind of relief temporarily. Again, they might have to repeat. So you have to tell the patient, even though you got this relief, you might have to come back after 8 or 10 months. When the symptoms resurface, you have to come back. So that kind of education you have to give the patient. Or the patient will be thinking, well, the doctor treated me, again it has come back. So you have to tell him that this is not a disease which gets cured completely. You might have to come back but he will come back. Once he finds that the relief, he will naturally come back to you. So Pradhamana Nasya. So what we use regularly is, this is something which is said in Ashtanga Sangraha, Nimba, Kushta, Katpala and Marija. And then Shundyadi Taila is said in both Ashtanga and Sushruta. So we give that as Prativarsha Nasya. So we start off with Pradhamana Nasya, that is 7 days we give them Pradhamana Nasya. We ask the patients to come to our hospital and do Pradhamana Nasya. We don't advise them to do it at home, because it's not easy to do like other Nasyas. So Pradhamana Nasya, they come. Then we give them Shundyadi Taila Nasya for at least 3 weeks. Some of them continue for more, but by then they will be having, I told you, more than 50% they will be having relief. So have you seen Pradhamana Nasya being done, Churna Nasya being done? Do you want to see it? So you can see that. Can you see this? So this is that pen, you know the pen, 5 rupees pen? Huh? That pen, that cylinder portion. We have taken that, and then we have taken this BP handle, the rubber tube. That thing which you used to press it, no? So we have taken that and fitted it on that. So what we will be doing, this is churna that is kept in the gogarna. And from this gogarna, we will be filling it by pinch. So we have already done a PG study on this. So we have, in that study, we have given the maximum dose as 3 pinch. So again, so what I usually give is maximum of 3 pinch. That is 1 pinch you take. Initially, when you start off the thing, you give only 1 pinch, because you don't know how the patient is going to react to the Pradhamana Nasya. So you give 1 pinch. If the patient is comfortable, you can give 2 pinch next day, 3 pinch the 3rd day. Then you continue with the 3 pinch for the next 7 days. Okay. So now the 3 pinches taken. You just blow it. That is more important. You are not putting the churna inside the nasa. You are just blowing it with that way. So you can see her filling that. That is 1 pinch, 2 pinch, and 3 pinch. Okay, so this is as simple as that. Only thing is that things which you have to note here is that the churna has to be fresh. That is, you prepare that only very little amount of churna is required, but don't use old churna, because the churna can get fungal infection. I mean, the fungus might grow on the churna. You won't know about it. So after 1 or 2 months, you just take the churna. What happens is that you will be putting the churna with fungus inside it. So don't do that. Either you have to pack it very. You have to be damn sure that there is it is kept in a sterile environment, or then prepare it fresh and do it. Till now I have not got any complications. Last 2 years I told you I have been practicing this, and there hasn't been any complication with this. Only one patient I told you it was not a complication, she didn't respond. I still don't know why that happened, because now more than 100 patients I have treated and they have all got good result. Only one patient, she did not respond. So you can confidently do with this thing. For allergic rhinitis, you can go for this churnanasya. 2-3 cases. There are so many cases here. I just asked the PGs to send me 2-3 cases which we have already recorded. So this is one case. That is a 52-year-old male patient presented with paroxysmal sneezing in early morning and on exposure to dust since 20 years. It was associated with watery discharge after continuous sneezing. Then he took allopathic treatment, homeo treatment. He got only symptomatic relief, and that too after a long-term usage of medicines. On stopping the medications or on exposure to allergens, condition got exacerbated, and so he came to us. So we gave Nimbadi Pradavanasya 7 days, starting from 1 pinch, increasing to 2 pinch and then 3 pinch for the first 3 days. Then the dose of 3 pinch was given for next 4 days. So time of installation was usually during 8 or 8:30 a.m. So from the second day of Nasya itself, the relief of sneezing was noted. On 5th day of sneezing got reduced from 2 to 3. See, from 10 it was reduced to 2 to 3. And after 7th day, the sneezing got completely reduced. Then the patient was advised to do Shundyadi Nasya for 2 weeks. So after 1 month follow-up, no recurrence of symptoms were noted. So similarly, all these cases. So that is all about the pratisyaya. I hope you got a good understanding about that. I'll just repeat, I'll just give you a summary of whatever I told you. So first you have to, when a patient comes to you with a pratisyaya, you have to first understand his nidanas. So what is his nidanas? Then next thing is you have to understand which stage he is in. So which are the stages? Namavastha is there, Amavastha is there, Pakvavastha is there, and Dushta Pradishaya is there. So Navavastha, I told you, just 1 or 2 days of history, you just leave him as such, give him Kavala, give him steam inhalation, that will be sufficient. If the patient again comes back with Jwara, Aruji, then Vaktra Vedasada and all those things, then you have to understand that he is in Amavastha. So at that time, what can you do? You give him, you have to give him something to give it, to make it Pakwa. You can give him Sweda and Kabala here, and along with that, you can give him medicines like Ardraga in Payas. Ardraga or Ardraga Swarasa or Shundi, you can give in Payas. Okay, so then you will, that change will come to Pakvavastha. So in Pakvavastha, all the symptoms that was there in Amavastha will be reduced. So the heaviness and all those things will be reduced, kshabadu will be reduced and all those things, then you consider that as pakvavastha. Usually a chronic patient, that is a patient who comes to you with that history of long exposure, long years of disease, is usually in his pakvavastha. So you can directly go for nasya. We don't have to give ama, pajana or anything. You just go for pakvavastha, the nasya. So then you have to identify whether it is vada, pitta, kapha or rakta. Pakvavastha. So vadiga will be, what are the symptoms? Tanusrava, granobarodha, kshabadu. Then kabaja, shiro gaurava, gatra gaurava. Then kapha will be thick, then white color, then you consider it as kapha. So you have to give, like I said, you can go for internal medicines, but more effective will be nasya. So in Vadika Pratisyaya, I just gave you one example, that which we are practicing commonly, that is Pipalya the Ayurveda Nasya. And in Kabaja Pratishyaya, we generally give Nimbasava with Saindava, we give Tulasi Swarasa with Saindava. We don't use Anudaila. So you have to remember that Anudaila is not the medicine for sinusitis. Anudaila is causing irritation and bringing out mucus, but that won't cure the disease clearly, completely. That is regarding that thing. Then in sinusitis, again, Kabaja Pratishyaya is generally considered as sinusitis. Nidana is very important. If the patient does not adhere to Patya, then the disease is not going to get cured. So you have to advise all those, you have to ask him to avoid taking all this Kabaja, like Masha, curd, etc. You have to ask him to avoid. Fish is also an important Nidana of this thing, because in Kerala people take a lot of fish. So fish, curd, etc. are abhishandi. That can also aggravate the condition. So you have to ask the patient to avoid that. Then medicines I told you, Nimbasava and all those things. Then next is allergic rhinitis. Allergic rhinitis again is you can give medicines, but it will take long time. So what we practice is this nasya, Nimbade Pradhamana nasya, very safe to practice. So you can do that, Nimbade Pradhamana. Then coming to dosha, I told you there is some kind of avarana for vada, prana or udana vada, that is being avarana is caused by kapha. So when you do pradhamana nasya, only that avarana is being removed. Vada is still there. So you have to give some brahmana nasya, but not purely brahmana, because kapha is already there. So that is why shundyadi is preferred. Because shundyadi, even though it is a taila nasya, it is having all tikshna ingredients, like shundi. So here that vada kapha shamana will be achieved. And after that, maybe you can continue with Anudaila for 1 more week. But I don't generally do that. But theoretically, when I look at it, like you start with Pradhamana Nasya, go to Shundyadi, then you can go on to Anudaila Nasya, there's no problem. But in practice, Shundyadi is sufficient. With that, the patient is happy. And in some cases, it does recur after 7 or 8 months. He comes back, takes Nasya, he'll be relieved. There's no need for giving internal medicine. Okay. So that is all regarding Pratisyaya. So to conclude, Pratisyaya can be managed by a general. I hope you got that confidence. Have you got the confidence? Yes or no? Yes. So you can confidently treat Pratisyaya. If you know the avastha, you can just go for the treatment. And whether it is amavastha or pakvavastha, then need to understand the samprapti or dosha involved in the samprapti, and then you will be having an effective management. Okay? So thank you for giving me a patient ear.